My name is Jae H. I'm a family practice and I've been at Edmonds Family Medicine. I've been doing family practice for a long time. I initially went into family medicine because the idea of helping people at the beginning of the disease process when they're still healthy and not had complications and helping them manage that to avoid problems towards the end of the disease process was really attractive to me. It seemed like you could really make a huge difference at the right time in people's lives. I also enjoy relationships. I love taking care of my newborns and my pediatrics, as well as doing well care and helping people through the life cycle all the way to the end of age. I treat a variety of chronic medical conditions. I enjoy chronic disease management, so that could be everything from diabetes, hypertension, depression, anxiety. I do quite a bit of gynecology care, and I'm able to manage most gynecologic conditions up to the point where they need to be referred for surgery. I think that the advances in current medical practice, the fact that we are all going towards an approach of evidence-based care, that there's so much more evidence rather than doing things because they were just done traditionally, that the benefits to the patient are enormous. So I think this is a really hopeful time in terms of if you are diagnosed with a condition that is serious or anxiety provoking, that they're really good options for care, and there's no reason not to be hopeful. The reason that gets me up in the morning and coming into work every day is because of my relationships with my patients. I love my patients. They are, many of them, very much like family. We have grown together. I have some patients that I helped take care of their pregnancy. I delivered their child. I cared for their family. Now I'm seeing those children as young adults entering college and taking care of all the problems that just life and age kind of hand to us. So it's rewarding to grow with my patients. It's also rewarding to invite new people into that family and help them make the best of their healthcare choices. I'm inspired daily by my patients. Often struggle with very difficult medical problems, disabling problems, and they are still able to empower themselves, to take charge of their health, to do the things they need to do to function and get the joy out of their life. And that is inspiring to me, that they keep going and that they place trust in me to help them with that. The most important thing is to respect and listen to the patient. I think when you respect the patient as their own expert, then they will always be at the center and also the most important voice in that pyramid or conversation. Team approach is really important on a lot of different levels. One is just communication. When somebody has a lot of care providers, and especially if coordination is needed, you are much more likely to have a good outcome, as well as less frustrations and barriers for the patient to get there if everyone in the team is talking to each other. I build relationships essentially with listening. I think, again, that is like the most important tool that we have, is to be open and reflective and to listen without judgment. I think trying to keep that communication open at all times. If there are stumbles, to make sure that we address that. I have two children who are still small, and so I think just family time has been a real priority. We like to hike and do just sports and camp, and before the pandemic, travel. I do a lot of cooking, and so those have been something that we've gone back to this year. We've recently developed an interest in puzzles and board games like every other family. Yeah.